Hey everybody. Hey, it's finished a busy day here on a Thursday. Been seeing patients all day. Well, having some meetings in the morning and then busy evening with patients. And what I want to do is I want to jump on today just to go through some of the different types of imaging that are taken, as I've had some questions coming in from patients. So the main thing we're going to be talking about today is the difference between MRIs, X-rays, CTs and ultrasounds, and to let you know when they should be used and of course what we use here in the practice. So for the main different types, the difference comes down to what is actually being used in terms of how they're measuring. So what this means is it can be using radiation, which means CT or X-ray. Then it can be using magnets, which is using MRI, or it can be using sound waves, which is ultrasound, hence the name ultrasound. So we'll start first with the X-rays and with the CT scans. So the X-rays and CTs are both using different types of radiation, both what we call ionizing radiation, so it can penetrate the body well and see what's going on inside. The main difference between the two of them is the X-ray is technically not quite as accurate, because what it's going to show really is just what's happening with the bones and at a very small level what may be happening with some of the soft tissues. CT is much more accurate and it will show more accurately what's going on, especially in some of the soft tissues such as the muscles or other scans they do, say, of the heart or of the chest. Now the reason why then we would not take, or say especially for ourselves as chiropractors, and a lot of people don't take CTs, is because with this enhanced accuracy also comes more radiation. This can potentially be more damaging to the body. However, it can be very important in certain cases to try and dispel what's going on between the two parts. So typically, say when somebody's having an X-ray after a fracture or there's something going on with certain bones in the body, an X-ray is going to be the best choice. However, if there's something going on which may be also affecting the soft tissues, such as a problem with the lungs or a problem with the heart, this is when CT is the best choice. The other thing that we see a lot is people who are coming in with their results from MRIs. MRIs are especially good at showing what's happening in the soft tissues and going really through the body so that we can actually, using technology, create this cut-by-cut layer of the body, seeing what's going on at different parts and analyzing those different parts as well. This can be very good if there's issues especially affecting, say, certain parts of the lower back, such as if it's affecting the discs. However, it's very commonly used also for issues going on in the digestive tract or even going on in certain other nerve and blood vessel pathways. MRIs generally will take a bit longer because they use what's called magnetic resonance imaging, and essentially it's a gigantic magnet spinning around and around the body to create that 3D image that can then be enhanced and used afterwards. For this, it would generally be, again, for certain other types of conditions. However, as a chiropractor, it's not something that we see or use quite as much. The other, number four, the four ones we're talking today would be ultrasound. Ultrasound is especially good for looking at particular types of soft tissues. So this is good at looking at muscles, it's good at looking at cartilage, it's good at looking into certain types of joints. It's especially good for looking at parts of the shoulder or even to the knee as well. This is good for seeing if there's been any tears in the muscles or if there's any change, especially around certain joints. Say somebody gets an injury where they've been very sore into the shoulder and it's been painful on certain movements. The MRI will see if the muscles are then having any problems, if they're interacting improperly, or if there's any problem with the tendons as well, all these different soft tissues. So really, the way that a doctor, whether it's a medical doctor or a chiropractic doctor, will choose which type of imaging to use will all be dependent on what kind of problem you have or what they're trying to diagnose and check for. For us as chiropractors, especially here at Vitality Chiropractic, our main utilization is X-ray. X-ray is the best way that we can see what's happening with the bones while minimizing radiation and making sure that we can have our care as accurate as possible. X-rays help us to do two things. Number one, to examine the overall condition, and number two, to see how to adjust you to make sure that any treatments we do are as accurate as possible. If you have any questions, whether it's about MRIs, X-rays, CTs, ultrasounds, any other types of imaging, or even just general questions about health or chiropractic, feel free to give us a call on 8438-9550, or you can email us at help@vitalitychiropracticcenters.com, or go on to vitalitychiropracticcenters.com just to find out any more information and to find out more about how we work. Again, if you have any questions, you can also leave them in the comments. Otherwise, I'll see you next week for our next live.